Hello, Vicente. My name is Jana Watson, and thank you so much for coming to let us interview you. We are in a Trends and Issues class, and we were going to ask you some questions about emergency room nursing. We understand that you're the director of Covenant Medical Center's emergency room.
Yes, ma'am. I currently took the nurse manager position about 3 months ago, so I'm in a transition phase of learning being a manager of the emergency center.
That is awesome. That is awesome. I'm sure you're doing really well at it. Okay, well, we're going to ask you some questions, and they're timed, so we'll have to be pretty quick with them, okay?
Yes, ma'am. And thank you for having me today.
You're very welcome. How is the transition to computer charting going, and do you see any further issues with that?
It was actually recently, I went to a steer conference about a week ago. That was a hot topic about the computer charting EMR training. So it is a new trend that we're seeing in healthcare that is moving forward, that you're seeing more healthcare going towards computer charting. You know, with some of the things we found out is every organization is finding out some of the things that can improve our healthcare, but it's also causing a little bit of time management, and you know, now you're relying everything on computer system. So I think where the trend's going through, people are recognizing what programs are easy, because we want to find a computer system that actually is kind of user-friendly for the healthcare, but also can help with the administration side. So that's probably the key component that was talked about while we were at this conference.
Cool. All right, I'm next. Okay, so how are you personally creating a safety culture where if a nurse makes a mistake, he or she can report it without fear or punishment or retaliation?
Well, that's the thing currently that I'm working on, that because in our organization we have we're actually pretty unique ER because we have to have some standards that we have to hold with sepsis accredited, or I'm going to take it back, from trauma accreditation, stroke accreditation, chest pain accreditation, and currently we're working on sepsis quality. That is something that we're kind of looking to staff, that we're educating first. That's a quality education, not that we want to come and say, hey, this is what you did wrong. So we start with quality improvement, which is something we've always had with trauma, and educate the staff. And one of the things I actually talked to one of the nurses today, that one of us always help represent the case with the stroke coordinator and also the trauma coordinator. So we work together. And one of the things we look at is the process first, not the nursing issue. Then we kind of give feedback of what to improve. So we make it a learning experience and not like you're in trouble experience. So that's what we call it.
Okay, well, so we all know that ER nursing is stressful. What are you doing personally to improve the lives of the nurses that work for you?
You know, that's one thing about emergency medicine that I've had a compassion of working for 11 years. And personally, when I got in, it was to kind of filter out the throughput process of the ER. One of the things about with emergency medicine and where JACO's going is keeping how long those patients stay there. There's two things we've been working really well the last 3 months is the acuity level of what we see, and the throughput of the ER, that we've been working with our medical director and our leadership to help decrease the stress by helping making sure our workflow is easier working through the ER and getting these patients upstairs to the appropriate care where they need to be. So that's where, if you have a patient down there for 6 hours versus 3 hours, your stress level decreases. So that's what we're moving with our ER. That's our goal for 2013.
Okay, and I have another question. When the emergency department is short-staffed and all the beds in triage are full, what do you feel is your responsibility to your staff?
There's two responsibilities I like to say. There's the staff and the patient. That's the most important thing, is the staff with the patient, that you're taking care of that. We've actually now have implemented and finishing up and finalizing what's called an action plan. When we are high acuity, we're backed up, patients are in the hallway. We are now looking at finalizing this in the next couple of weeks, where there's an action plan where our leadership gets in, where now one of the things will involve calling in resources. So the key is resources and throughput of getting the patients upstairs. And I'm excited about it because it's just about to start. So we're notified, whoever's on call, to come in and figure out we're backed up, we got to do this, our patients are in the hallway, and we have staffing. So we're currently working on an action plan to finish up this process.
Okay, well, thank you very much.
Okay, how do you deal with customer complaints?
You know, there's two types of complaints that we get from. One's called the HCAP surveys, and then a survey that we have in our internal department that we send out by mail, or by telephone. Actually, there's a telephone. So, and there's another thing, is one of the things that every patient that gets discharged, we have about 5,000 people that get discharged per month. They get in the front cover, there is a contact information where they can call me if they feel like for any concerns of their care during their ER stay. So we either get a phone call or get an email. A lot of our leadership also gets feedback back. I address and look at look at the chart, and then I also will actually ask the nurse to come in and help me review it. And because there's always two types of perception: there's the patient's perception and there's the nursing perception. So I review both cases, and I guess the one thing I always ask is, was there a professional involved? So we do review it, and we discuss it, and we kind of go from case to case.
Hi, Vicente. My name is Michelle.
Hi, Michelle.
My question kind of goes along with Mallory's. What does good customer service mean to you, and can you give us some examples of that?
Yes, ma'am. One of the things that we encourage a lot about, that our organization leans forward to, is what's called AIDIT. It is a form of communication tool that's very well known in our community and also in other organizations. Healthcare goes through a profession. We are held as a standard, as a professional standard, and we have what's called AIDIT, which is a way of introducing ourselves, acknowledge ourselves. We introduce ourselves to our patients, make sure they know our names. We also explain and keep, during the time of their ER stay, patients want to know, they want to hear what's going on. So we're very strongly encouraged to tell them what the procedure, what's going on, to decrease the anxiety of a patient who's never been to ER. So we also have the explanation, and set the expectation of what's going on and what to expect when they come into our ER. Because a lot of people don't know when they come in how long certain tests take. So our nurses are educated and train the patients, and we go back and communicate. So our customer service relies on making sure they know who's taking care of them, explaining the procedures, and then make sure they're getting the education even when they get discharged. Are they getting the right discharge information? Especially in an environment that's so rapidly moving. Communication plays an important role.
Great, thanks.
Vicente, what are your feelings about standardizing the entry-level position for nurses to be a BSN level?
I think that's a topic that's talked about in different areas of the nation. There are certain states that are required that nurses have a BSN. I think if you're to ask me, do I feel, is there a quality of care? I don't think there's a quality, because I think there's excellent nurses who don't have their BSN. They provide great, excellent care. But I think the one thing that it does show is professionalism. It's a standard of us showing what our profession, how we grow, that, in organizations encourage. I feel like, if we can move it together in an area where we're trying to push our profession to our nursing degree to a higher level that all maintain a BSN, it would be a great goal to move to.
And my last question that I have is, if you observed unethical behavior by one of your staff members, what would you do about it?
If I observe it, depending on what the first thing I will do is review the situation, especially in emergency medicine, because it becomes a place where sometimes people are frustrated. So the first thing I want to do is de-escalate the situation. So I review the situation. If I witness it, I actually interrupt and go in and de-escalate the situation between the patient and the nurse or the staff. First, we'll take care of the patient's needs first. So if it requires that another nurse or another person assume care, then we'll do that first. And then we'll make sure the patient's taken care of first. And then me and the staff will sit down and we'll talk about the situation. I think sometimes you have to look at it as what caused and what led to the escalation situation, and then review if it was held. I always hold people accountable for their profession. You got to be professional. Even though people can be very frustrated and say negative things towards you, but you got to make sure you got to maintain that professionalism. So you review it, and I'll review it from case to case.
Okay, my last question is a more broad question. With the new initiatives in healthcare reform, are you noticing any changes in your unit?
It's coming. Yes, ma'am. The healthcare reform and where it's going, there's going to be changes coming. And it's kind of coming right now slowly. As for anybody who's looking for 2013 or looking at the healthcare reforms and those who are getting more educated about it, it is something that we got to be prepared. So we are fixing to be implementing our changes just to be ready for the healthcare reform. So that's where we're trying to get ahead of the reform and educate the staff on where it's going. And I think the key thing about it is the staff is, what's been the last 3 months is I'm educating myself on it, that it's giving them the why we need to do this. And it's going back to reimbursement. So it is coming that it's going to be moving forward with it. So the next year, we're going to be moving forward with healthcare.
Thanks.
Cindy, my last question is, with the concept of the future of nursing moving from the institution into the community, and lots of nurses going into the community, how do you hope to retain some of your nurses in the emergency department?
How to retain them? You know, I think I want to be honest with them and let them know where the expectations are. And that's the hard part when you have to come in and explain to them that this is where healthcare is going. And as we start moving forward, I definitely would be honest up front about what's going on, because you're going to start looking, are we going to have, if we have a decrease of where healthcare is going, we have a decrease of patients, we have a decrease of FTEs. And that's where, you know, we have to be, and we're trying to get together, our leadership is trying to get educated enough to know where this is going so we can let the staff know what to be expected. So it is something that anytime you deal with people's lives and schedules and watching how much they work, it really does affect their lives, but it's because we're moving towards healthcare and what, you know, the reform where it's going. So it's going to be something, it's going to be hard, a little bit difficult when it comes, but I think my job is to try to educate and try to help out, and also try to do what we can to get the reimbursement we can for the healthcare.
Thank you so much for
Thank
taking
you.
time to visit with us today. We
Oh, thank
appreciate
you.
you coming here.
Well, I appreciate your time, and hopefully I answered your questions, and thank you.
You did very